To you, Jerome M. Adams, United States Surgeon General, I present to you the following. I'm here to represent the United States Public Health Service. This policy memo evaluation serves to outline the timely need to address the misinformation, disinformation, unvalidated, and false information regarding the efficacy, development, value, and importance of vaccination in our nation. First, we need to identify the issue. Social networking sites are extremely effective. In capacities not previously possible, social networks allow us to connect and communicate with people from all over the world, and serves as a public forum to share ideas and opinions. We use these sites for sharing information, obtaining news, and for entertainment. However, the influence and reach of social networks allow for the uncontrolled spread of misinformation regarding vaccines, including the efficacy, formulation, and importance of vaccination. However, lack of oversight and monitoring allows for this rampant phenomenon to occur, and currently there is no policy in place to address this issue, leading to the reemergence and development of previously eradicated diseases. Now to provide some background. When used, social media is extremely powerful, but when used responsibly, social media is incredibly valuable. As previously mentioned, we use social networking sites like Facebook and Twitter to communicate, to access and connect with people from all over the world. For some, social media is a source of entertainment and distraction. For others, sites like Facebook and Twitter serve as an information hub about current events and hot topics. More and more celebrities, athletes, and professional groups are using social media sites as a platform to implore changes to policy or treatment towards groups of people. News regarding a single event can be shared globally in a matter of minutes, and discourse can commence just as quickly. For over 60% of users, Twitter and Facebook serves as their primary source of news. Unfortunately, efficient accessibility to information and news can be abused and used for less positive purposes. With the upcoming 2020 presidential election and the continued spread of novel coronavirus COVID-19, we are seeing an especially dangerous uptick in the spread of mis and disinformation. Misinformation and disinformation, while often used interchangeably, are two distinct forms of false information. As defined by dictionary.com, misinformation is false information that is spread, regardless of whether there is intent to mislead. However, disinformation is, as translated from the Russian dezinformatasia, a subset of misinformation, which is false or manipulated information spread deliberately to deceive. There are no punishments or penalties for sharing untrue information, nor is there any requirement or incentive to post factual information. Anti-vaccination supporters, also referred to as anti-vaxxers, are the single demographic that participates in this conduct more so than any other group. Stemming from a now redacted 1998 Dr. Andrew Wakefield study linking the administration of vaccines to the development of autism in children, anti-vaxxers have infiltrated social networks to spread what they believe is the toxic and dangerous evils of vaccinating against preventable diseases. This subgroup of the population firmly believes that doctors and government organizations like the CDC and NIH are lying about the importance and efficacy of vaccinations. Many believe that just because some of the most deadly illnesses have been eradicated by vaccination, they are no longer a threat. Others believe that the side effects or rare adverse effects that may occur are more serious than the disease the vaccinations actually prevent. While these are all valid concerns, the methodical cherry-picking of information and spread of the subsequent misinformation poses a bigger threat to public health than not vaccinating at all. Like I mentioned, there are no policy issues in place to address the spreading of false information through public internet forums and social media sites. The pros of implementing such policy include setting a precedent and communication to the general public the value of primary sourced, peer-reviewed, and scientific community validated information regarding vaccinations, as well as maintaining freedom of choice while introducing innovative solutions and penalties to the growing issue. Additionally, these changes have the potential to create jobs in IT, search engine optimization, coding, and health sciences. Lastly, but possibly most importantly, a policy that reinforces the importance of protecting the immunocompromised communities and those who truly cannot be vaccinated. However, there are some possible negative consequences, including the argument that one's First Amendment rights are being infringed upon. Additionally, large and costly sweeping reforms take time and may not be immediately effective when addressing pandemics like COVID-19 and measles outbreaks like we saw in California. Attempting to control one's choices on public forums may also increase distrust towards government entities and the healthcare system. The first option is to create a social media oversight division, which will monitor and regulate certain behaviors on networks. This could either be implemented at the federal level, in which a government agency will be created, or current would be expanded upon. The division would consist of professionals and experts that are then responsible for creating and manipulating coding that would trigger a warning notice on posts prior to publishing. Posts that contain certain keywords, when identified, would trigger a warning notice that will alert the specific user that something that they are sharing contains inaccurate or false information. This would allow the user to still continue to post, but after sharing, there would be an indicator to denote that the information is from an untrusted source. This option would allow users to maintain control of their social media accounts and maintains First Amendment rights to freedom of speech, but informs the selected audience that the information is false or misleading. A second option would be to pursue legal action against those who are guilty of sharing mis and disinformation. A three strikes policy would be in place that would attach various solutions to this growing problem. For the first offense, a warning or citation would be given, and temporary suspension of social media profiles would be implemented. A second offense would result in mandatory education sessions held by community health professionals, doctors, and additional programming about the importance of vaccination and remaining cognizant about misleading misinformation. For a third offense, the individual would face a penalty of a fine or jail time, with each jurisdiction having the freedom to charge as a misdemeanor or a felony. Possible charges could include reckless endangerment of a child or negligent homicide if their conduct results in death. A third and final option would be to allow health insurance providers the option to not cover costs and claims associated with vaccine preventable conditions. This would effectively address the discourse that floods social media sites, where parents and even some pediatricians advise the use of unmedically sound treatment options. Policyholders would not be barred from seeking medical treatment for themselves or their children, but they would be 100% responsible for the costs. Costs would be comparable to what is charged for those seeking out-of-network care and or price negotiated for out-of-pocket patients. This option, however, fails to protect the immunocompromised if unvaccinated individuals choose to leave their homes to seek out treatment. Lastly, I'd like to leave you with a visual comparison evaluation of these three options, a brief description, as well as how the options compare in regards to the individual impact on consumers and the additional cost for taxpayers associated to each possible solution. Upon comparing the cost-benefit of each option, the best proposed option would be to implement a three strikes policy where offenders would first be issued a warning and temporary suspension, then mandatory education sessions, and finally, on a third occurrence, possibly face jail time or hefty fines. Thank you for your time today, Jerome M. Adams, United States Surgeon General. I hope you carefully consider the three options I've proposed today, and if appropriate, select and implement the one that would be most effective in addressing the spread of mis and disinformation regarding vaccinations online.